Let me be blunt about something that frustrates both employees and researchers. Most workplace wellness programs are performative corporate theater that makes companies look good without actually improving employee health, while genuinely effective interventions remain unimplemented because they cost money or require cultural change. The wellness program landscape is varied. You've got health risk assessments and biometric screening. These are the programs where they check your blood pressure and cholesterol and tell you if you're at risk. Research shows these produce limited behavior change. You've got fitness challenges and incentive programs, step challenges, weight loss competitions. These create short-term engagement but minimal lasting impact. Then you have structural changes, things like ergonomic workstations for everyone, movement-friendly policies, organizational culture change. These show sustained benefits, but are rarely implemented comprehensively. Evaluating program effectiveness requires looking at actual outcome metrics, not vanity metrics. Reduced pain reports, decreased healthcare costs, lower absenteeism, these are meaningful outcomes. Program enrollment numbers and participant satisfaction scores are vanity metrics that don't indicate health improvement. A program can have high satisfaction while producing zero health benefit. The ineffective but common programs are familiar to anyone who's worked in a corporate environment. Lunchtime yoga classes, these are helpful for the small percentage of employees who can attend, but most people can't take lunch breaks for yoga because of work demands. Wellness newsletters that nobody reads. Fruit bowls in the break room, which have minimal health impact. These are easy, visible, and ineffective. The effective but rarely implemented interventions are telling. Ergonomic workstation assessments for all employees, not just those who request them or develop injuries. Movement break policies with manager accountability, where managers are evaluated on whether they support employee movement breaks. Organizational culture change that prioritizes health and makes movement the norm rather than the exception. These work, but they require upfront investment and ongoing commitment. Employee advocacy strategies can push for better programs. Request evidence-based interventions through employee resource groups or union representation. Participate in wellness committees and push for programs with actual research support. Collective action through formal channels when programs are inadequate or purely performative. From the employer perspective, the business case exists but requires looking beyond immediate costs. Programs that reduce workers' compensation claims show clear return on investment. Reduced health insurance costs from preventive interventions benefit both employer and employees. Retention benefits when employees don't leave due to health problems caused by the workplace are substantial, but often not calculated. The victim-blaming problem is pervasive and concerning. Programs that place all responsibility on individual employees, eat better, exercise more, manage your stress, while ignoring structural workplace problems that cause injuries and stress. This is fundamentally unjust. If your workplace culture punishes movement breaks, providing a gym membership doesn't address the actual problem. What the research clearly shows is that individual-focused interventions have limited effectiveness in toxic workplace cultures. You can give employees all the wellness resources in the world, but if the culture demands presenteeism, if movement breaks are penalized, if ergonomics are seen as special accommodations rather than standard practice, those resources won't be used effectively. The comprehensive wellness programs that actually work share common features. They address environmental factors, physical workspace, policies, culture, not just individual behaviors. They have leadership commitment with resources allocated and accountability mechanisms. They include employee input in program design rather than top-down mandates. They measure real health outcomes and adjust based on data. What concerns me is the regulatory gap. There's no requirement that wellness programs actually work. Companies can implement ineffective programs, get positive PR, maybe even get insurance discounts without producing any health benefit. Meanwhile, the structural problems causing injuries persist. For employees in organizations with inadequate wellness programs, the strategy is advocacy combined with individual action. Push collectively for better programs while implementing personal ergonomic and movement strategies. Document health problems and their workplace causes. Use available resources while recognizing their limitations. And ultimately, sometimes the answer is finding an employer that actually prioritizes worker health over wellness theater.